I'm Dr. Joe Maroon. I'm a neurosurgeon at the University of Pittsburgh in Pittsburgh, Pennsylvania. And I've had a long interest in traumatic brain injury. I've been the team physician and neurosurgeon for the Pittsburgh Steelers for several decades and have managed and developed various testing procedures for evaluating concussions and traumatic brain injury, particularly in athletics, but also working with veterans. So the question is, why is hyperbaric oxygen therapy important for veterans with post-concussion syndrome, TBI, and PTSD? I think we have to first look at what is PTSD, post-traumatic stress disorder. And one of the most well-developed evolutionary biological emotions that have evolved over hundreds of thousands of years is that of fear. And when we are subjected to an environment or an episode that elicits fear, there's an immediate brain reaction. Emotionally, we call it the hypothalamic pituitary adrenal axis, the HPA. And what happens is the brain stimulates the pituitary gland for the adrenal gland to release a lot of epinephrine or adrenaline and also cortisone. And these chemicals in our bodies affect the brain in such a way that it encodes memories in the hippocampus and the amygdala, which are parts of the brain located in the temporal lobe here, get encoded in the amygdala, which is a almond-shaped structure in the medial temporal lobe here, and they are there forever in terms of memory. These fears, these exposures get hardwired in the brain, so they're subject to recall, to rumination. And when that happens, that's called PTSD. You can't stop thinking about the explosion or the wound that was inflicted. How do you pluck from memory some rooted sorrow? Well, this is what the Veterans Administration spends billions of dollars on antipsychotics, on antidepressants, on cognitive therapy, on all sorts of therapy to try to pluck from memory these rooted sorrows. In a large part, they're unsuccessful. That's a long way of leading into what does hyperbaric oxygen therapy do? You have to understand first, what is hyperbaric oxygen therapy? Baric stands for pressure, high pressure oxygen therapy. So essentially what it is in a special type of chamber under pressure, 100% oxygen is inhaled or breathed. There are physical principles that say under pressure, more oxygen gets forced into a liquid. So we know that hemoglobin is the oxygen-carrying molecule or blood product that carries oxygen to our brain. So when we're talking about a partial pressure of oxygen, PO2. What is the PO2? It's the saturation of oxygen. Well, our hemoglobin is usually saturated fully, 99%. Under pressure, breathing 100% oxygen, one then increases the oxygen-carrying ability of the plasma up to 17 times. So your body becomes hyperoxic. Oxygen is healing to the body. We know that oxygen has been used for many decades to heal wounds of the extremities. Very little attention has been paid to non-healing wounds of the brain. And that's where hyperbaric oxygen therapy becomes very useful. So the question is, what happens in the brain physiologically that would make it imperative for veterans, 20 of whom commit suicide every day in this country, primarily from frustration, from anxiety, and from depression, oftentimes associated with PTSD. A Greek philosopher said, you can never put your foot into the same river twice. Well, the brain is the same way. The input, the visual, the olfactory, the auditory, the gustatory, these sensory inputs are constantly making new connections in our brain. So what does hyperbaric oxygen therapy do? It does several things. Number one, it enhances neuroplasticity. In other words, it increases the synaptic connections between neurons, and it also enhances neuronogenesis. It makes new neurons. Number two, it enhances the function of mitochondria. There's a condition called mitochondrial biogenesis. It actually makes new mitochondria. What do the mitochondria do? They're in every cell of our body. They take oxygen and glucose and make ATP, energy, the fuel that propels everything that we do in our cells of our body. It also enhances new stem cell formation, which creates new tissues and helps in healing. It enhances vascular endothelial growth factor, which makes new blood vessels. And it also enhances BDNF, brain-derived neurotrophic factor, does three things. It makes new neurons, it increases synaptogenesis, and it enhances neuroplasticity. So physiologically, there's a very powerful basis and substrate for the use of hyperbaric oxygen to heal the brain. 11 states have recognized the fact that hyperbaric oxygen therapy is effective for post-traumatic stress disorder, post-concussion syndrome, as well as post-stroke. But this is a paper by Shai Efrati and Amir Haddani entitled Hyperbaric Oxygen Therapy for Veterans with Combat-Associated Post-Traumatic Stress Disorder. This was published last year in the Journal of Clinical Psychiatry, a very high-rated peer-reviewed journal. And in it, Dr. Efrati, Haddani, and their associates took 58 veterans and treated them, divided them into control, a sham group, and they found a very positive correlation with improvement, not only as their assessments of post-traumatic behavioral and cognitive disorder, but also in very special types of resting state magnetic resonant imaging. They were actually able to show improvement in the fiber tracts in the brain after hyperbaric oxygen therapy. And so what Efrati and Haddani and others have shown is that there is actually a rewiring of the brain due to neuroplasticity, angiogenesis, and synaptogenesis that occurs with hyperbaric oxygen therapy. So when you get back to the question about utilizing this for veterans and what should be done, first of all, I think legislators need to understand that there's been a renaissance in the use of hyperbaric oxygen therapy for the treatment of wounds of the brain. And with this understanding, I think would come, like 11 other states and legislators have concluded, that it is something that should be offered to veterans for their care. I think hyperbaric oxygen therapy can and will contribute to healing the brains of these veterans as well as others who suffer and experience PTSD and post-concussion syndrome. And the reason for that is detailed in a paper I recently published with my coworkers on the mechanism by which hyperbaric oxygen therapy neuromodulates the brain in terms of production of new stem cells, production of vascular endothelial growth factor, which makes new blood vessels, the creation of new brain cells, the new brain cell connections, and enhancing mitochondria, which are the energy-producing organelles in every cell of our body. So I believe strongly that hyperbaric oxygen therapy should have and will have and does have a pivotal role in the treatment of veterans, 20 a day who commit suicide because of primarily anxiety, depression, PTSD, and those with post-concussion syndrome as well. So hyperbaric oxygen therapy has been used for decades to treat various problems such as non-healing wounds of the extremities, non-healing fractures, carbon monoxide poisoning, the bends. These are all accepted practices. What isn't accepted yet is the use of hyperbaric oxygen therapy for treating wounds of the brain. And when I say wounds of the brain, I'm talking about traumatic brain injury, PTSD, post-stroke, post-COVID. Long COVID patients can benefit from this immensely, and I firsthand have seen this. So I think we're really at a period for a renaissance in hyperbaric oxygen therapy, recognizing it's been used effectively for decades for wounds of the extremities. Now, appropriate focus is being given to treating and curing wounds of the brain.